for joining us. If you were with us last Friday, we had our first webinar in the KCDD Future Planning webinar series. If you didn't attend last Friday, that's okay. I have a recording that I sent out this week. If you didn't get that, please just message me and I'd be happy to resend that to you as well. We're really excited for today's webinar. Today we have Dr. Tamar Heller from the University of Illinois, Chicago, who's going to be going over some of the components of the future planning program, kind of an overview, high level of what the program looks like and some of the pieces that are included in the program. And then we also have the fantastic Kacy Seitz, which I'm sure many of you are familiar with, who leads Whole Story Planning, which is a financial planning, national financial planning organization for individuals with disabilities and their families. And we're so grateful to have you here, Kacy. I know you are traveling today, so I'm happy that you could make this work and join us. So we have a lot to cover today, some housekeeping items. We have a Q&A chat where you can drop in questions. I can answer things as we go through the program today, but we will have some time for questions at the end. So if you want to drop your question in there, we can get to it at the end. You will not be able to unmute, I believe, so feel free to just drop it in the chat if you have questions. I'll be sending a recording of this webinar as well as the slides to you all. And if you are needing transcription, I believe there is a transcription function at the bottom. You should be able to transcribe. Please put in the chat if you're not able to do so, and I can figure that out for you. Okay. Rhonda, do we have Dr. Heller with us? Okay. Rhonda, can you go ahead and jump to Kacy's first slide, and we'll just jump into Kacy's portion of the presentation. And then Kacy, maybe you can introduce yourself. Oh, Kacy, we're not
Yep.
able to hear you.
Let me just switch the slides quickly. Just give me 1 second.
Great, thank you. We just have a lot to cover today, and I don't want to miss out on anything.
Hear me?
Yes, it's pretty soft. We can hear you.
See if I can get closer. How's that?
Perfect. Great, thank you.
Do you want me to just share my screen?
Rhonda should have your slides.
Okay, we're good to go.
Perfect.
All right. Great. And am I able to control them, or do I need Rhonda to do that?
Yeah, just let me know when to advance the slides.
Okay, go right ahead. So hi, everybody. My name is Kacy Seitz. I have been a parent to two children with disabilities for a little while now, and it has been a journey. And one of the things I learned really early on is that we all have sort of our own fears and emotions around planning long term for our kids who will be long term dependents, right? I know I definitely did. Well, that has been validated in research over and over again. And you're going to see here on the screen some of that research as it relates to caregivers like us across the country. Some of the statistics I will pull out are that 82% of us are concerned that we do not have enough financial resources to last our child's lifetime. That certainly was a fear that I had before I engaged in this type of planning. And so now that's what I do for a living. I help families figure that out. Some other things that I want to point out is that 59% of families do not have any legal documents that are really there to help protect or plan for their long-term dependent. And 87% of us are definitely concerned about what will happen to our child when we, as caregivers, are no longer able to do the direct caregiving or care coordination anymore. So, Rhonda, if you can advance the slide, one of the things that I hope to do today is really give you a better understanding of where I come from, who our family is. Go ahead and put all the bullets up, Rhonda, since I can't control this. Our daughter Hudson is 15. You can see her here in the picture. Keep going, Rhonda. There's a whole bunch of other bullets. And then our son Dominic, who is now 13, which is really hard to believe. So all of you guys who have teenagers or older, you can send loving thoughts and prayers that I survive middle school and early high school with these two. Hudson had a brain injury at birth, resulting in a lot of medical complexity. You can kind of see the list of diagnoses here. And then our son Dominic, he's on the spectrum. He was diagnosed with level 1 autism and moderate ADHD when he was like in first or second grade. It was right in the middle of COVID. It was such a fun time for everyone when we were doing school remotely as well. But both my kids have their own unique personalities, as do, each of our own children. Hudson is she's my girly girl. She loves to have makeup and her nails done. We can't leave the house without her clothes matching and a bow in her hair, or you will have a bad day with her. So she's taught me a lot about patience and appreciation for the little things. And then our son Dominic is, his biggest challenge is really social communication. He's a very smart kid. He is at grade level at school, but we've kind of learned that his executive functioning skills are extremely low. So getting that schoolwork done and, some of my concerns as a mom as he gets older, like how are you going to go to college and all of this when we can't really organize our thoughts and get them in right order. Those are things we work on and definitely do therapy around for him. But he's amazing. He loves Roblox. He and my husband Dan have a really good time watching Formula One racing, and he is a big believer in video games, as are many other young boys his age. Okay, next slide, please. I've done a lot of work as both a parent and a professional in terms of advocacy. I met Allison and a lot of the team at the Kansas Council on Developmental Disabilities through some volunteering there that I did many years ago and continue to stay in touch at the national level. I have been attending a lot of the Medicaid forums and things at the National Council on Developmental Disabilities, and it's just been really a journey and a lot of eye-opening learning. So I always encourage families and caregivers. The Developmental Disabilities Council in your state is your ticket and your voice to the legislators in your state. And most of those meetings are open to the public and are free to attend. Many of them happen on Zoom as well, or at least there's the Zoom capabilities. So I encourage you to get involved and to share your story. Because they don't hear from as many of us as I would like for them to hear from in terms of making decisions at the policy level. And there's a lot of advocacy work going on right now that is really, really important for things like waiver funding, caregiver pay, and even protecting access to waivers across the country. I'm sure Dr. Heller will touch on that too. I also hold as a professional financial planner the Chartered Special Needs Consultant designation. I think if you are interviewing other financial professionals to help you and your family, this is a designation to look for. It is specific to special needs planning and it is offered by the American College. And then I also do a lot of work with the Academy of Special Needs Planners that educates financial advisors, attorneys, and trust officers across the country. We're getting ready for a big conference in Miami in May. I will be attending and then also speaking at that. But that is more of a professional realm. And so they do have family resources on their website, though, that are free and absolutely something I encourage you to download and check out. Next slide, please. So our mission in my practice is to really work with families to figure out how do we navigate all of these different systems that are inherently separate and not communicating with each other. So we try to approach this with grace, integrity, and compassion. And oh my Lord, have all the patience in the world to get through this, especially if you have kids like mine, one with medical complexity, the other one a little bit more mildly affected. Next, please. So some of the things we hear from families every week are we don't know where to start because these systems are really siloed in terms of their information, and they are many times not connected in terms of where you learn something, or you might hear a piece of information and then not really sure where to go to figure it out. We hear a lot of the time that families are overwhelmed. And I would wholeheartedly agree with this sentiment. And there have been many times, even as a parent, just not a professional, that this has definitely been the feeling our family has had in trying to navigate the different benefits and services. But next slide, please. I do think there are steps you can take to minimize that overwhelm. And we work really hard with families to try and help them understand, what door or what window are we entering into the system, and then how do we navigate inside of that once you are inside. Sometimes we hear we have a lot in place already, but no funding plan for our kiddos' special needs trust. I actually hear this a lot. I have a special needs trust. We did guardianship. We've got an ABLE account. We're done. That is like 10% of the planning. And good for you for getting those things done. I think they're very important. But the rest of this story has to do with who's going to replace what you do, and do they know and are they trained on exactly what it is you do every day for your long-term dependent. Because if the answer is, well, kind of, or not really, then you haven't finished the planning. So this is something that we work on a lot, and try and help educate families on how to do this and really where to document things. Next slide, please. Sometimes we hear we have it all taken care of, which I love hearing this. I think this is good. This is usually a parent or a caregiver who is maybe at the 5-yard line, and it's really just about letting go of or passing the baton rather of the caregiving. And I think this is great, but sometimes we also need to double check everything as well. One of the things we see consistently is just that there has been no actual formal financial plan for the adult with a disability. And so that's where we come in and try and figure out what is that long-term budget, what is the projection, how much does their special needs trust need, how much does their ABLE account need, and how do those things work together when you're not the one pushing the buttons anymore. Next slide, please. Sometimes we also hear wealthy families don't need this planning. I think this is a really big misconception. In fact, I'd argue they need more of the planning, because there usually are more assets and more details to make sure we are figuring out. There just can be more loopholes in the system. And a lot of times, families who have a little bit more means don't understand the waiver system or think they don't need it. And unfortunately, you cannot private pay certain things. You cannot private pay home and community-based supports. You cannot get access to a waiver by paying for it out of your own pocket. And the waiver system is typically our kids' ability to be included in their communities and be supported in a way that allows them to continue to be socialized. It gives us a check and balance on their caregiving. There's a lot of really good things that the waivers offer, at least as of now, that, just because you have a lot of money doesn't really mean the planning is done or that you have a plan. So we talk through this a lot. And by all means, we work with families of all income levels and all, assets. And so this isn't just subject to that segment of the population. Next, please. I want you to keep in mind, it is never too soon to start planning. You do not have to do all of this at once, and you are not alone. I'm here in New York today, going to a funeral of a mom who her child passed away recently, last week, and I have known her on this journey for 14 of the 15 years Hudson's been alive. Through that experience, I have learned there is a different level of friendship when you connect with other parents who have the same diagnosis as your child. And I think it's really, really important to make those connections and keep that parent-to-parent support throughout your child's journey, no matter how old they are. But you're definitely not alone. There are a lot of people and a lot of supports to help you along this journey. Next, please. The most important thing in terms of financial planning that I always make sure to tell families in every single workshop we do is you should never leave more than $2,000 to a child or an adult with a disability, even if that is in a jointly held account. Next slide. The reason for this is because many of the federal, state, and local programs, things like Medicaid waivers, traditional Medicaid, supplemental security income, or other programs have asset and income tests that can apply, which means if we violate those tests, you have more than $2,000 in your child's name, you can either lose access to those benefits or they'll be suspended or reduced. And so we want to avoid that. And so that this is the basic and the whole reason why we do this type of planning. Next. So one of the reasons whole story planning, my planning firm, is different is we bring multiple stakeholders to the table. We educate families on how to interview these folks, and the family and you, if you are a family, get to hire and or fire these professionals as you will. So the first one is really where my professional life lives, in the blue area of this table, and that is a financial professional. And when I say this, I've learned in our industry, this can be different people. I am not talking about somebody who manages just your investments. I am not talking about someone who sells you insurance. I am talking about someone who does true holistic planning. And so you have to ask about that. Many, many, many of the people in our industry will call themselves planners when in reality they are there to sell you a product, or they're there to just manage your money. I want to know that the financial person you're working with is helping you understand not just how much life insurance you need, but the right type, the right kind, and has a variety of different places that they're helping you shop, not just their own representative carrier. We work with families a lot on the parents planning around long-term disability insurance, especially if the parents are still working. Long-term care planning is a huge gap area in most people's plans. Long-term care planning, that's if Dan and I were to have a caregiving event ourselves. So let's pretend that doesn't happen until we're in our 80s. Who's taking care of us, right? We have a big challenge if we have two kids that need long-term needs as well as our own. So that planning needs to be done early. Certainly savings, retirement planning, investment planning, and then ABLE accounts should be in that conversation as well. One of the other things that I think we do really well in comparison to a lot of other professionals is we will actually work with the estate planning attorney once the special needs trust is in place to figure out how much needs to go into that trust and when, and what exactly is going in there to be tax efficient over time. So that's what's called estate equalization and trust funding. Equalization meaning if you have more than one child like I do, I can't have an estate plan where it's just 50-50 in terms of the split of the inheritance. Why? Because Hudson arguably is going to need more care and more probably financial support than my son. But then the question becomes, well, how much more and what does that look like? So that's what we do together. We work on that planning. Next. The next professional is probably the one we get asked the most about, and this is a government benefits specialist. Certainly care coordinators and case managers can be very fluent in this, but not all of them are. Hudson has had probably 8 different case managers in her 15 years of life on earth. And this last one that I've worked with, I actually had to train her on our own benefits. And so that's very normal. That's a big common experience we find. And that's because, to their credit, case managers are underpaid and very overworked. So there's a lot of turnover in that space. So don't be surprised if you have a case manager or care coordinator that is not offered the maximization of your child's waiver or what other benefits are available to them. Sometimes they just don't know. They're just new or they haven't been trained on it. So a lot of the times we like to work with someone who is a benefits expert or consultant outside of the government system. And certainly there are local parents and moms and things in the different states we work in that we've connected with and can provide free parent-to-parent support. So don't think that this is necessarily something you have to pay for all the time, although that is an option if you are looking for someone to do what's called private case management. Okay, so this person or this team is going to help your family figure out how do we maximize and when do we start applying for things like SSI, Social Security disability income, Medicaid or Medicaid waivers, and then any other state or local programs that your child may be eligible for. Really big area. Typically, we start engaging with this person as soon as we can, but the most common age is around 18, 19 when we start triggering some of these bigger benefits. Next. The third professional is, of course, an estate planning attorney. We work with a lot of these across the country. They are going to write and edit the legal documents that you have in place for your family. So this will be things like a will, power of attorney, power of healthcare, guardianship, if that's of concern to your family. And of course, there are different levels of guardianship. We are talking a lot now about supported decision making as an alternative to guardianship. Power of attorney can be an alternative. Certainly conservatorship can be an alternative. And then they may also help you write the special needs trust as well as update that over time. The trust is what is going to name the people or the team, I like a team, that will be not only taking care of your child after you can't anymore, but who's managing the money? Who is making sure that person is accountable? Who's filing the taxes on the trust? Who's tracking all of the receipts? It's a detailed team and one that needs certain planning considerations. I would not put that on one person in your family. It's a really big job, and many of the family trustees that I've worked with over time are more than overwhelmed because a lot of the time they're also the caregivers, and it takes a little bit more planning to get that team in place. And so that's something we talk through when we're working with the attorney. And then the other piece here is the letter of intent, which after today's workshop, we will send out resources for some of these things. So if you guys are wanting, PDF handouts or whatnot, I'll have an email that Allison can send you, or Allison can send it forward. Next, please. So we bring this whole team together, and we also look at things like who is in your village of support now. Could be physicians, teachers, therapists, maybe other public and private programs. Next slide. And this is really going to build with you and your child in the center, who we are going to help us navigate all these different silos and complex systems. I found this is the easiest way to explain all of the big check boxes we need to have in order to make sure your child is safe, has a high quality of life, and we don't have things that we don't want, like financial abuse, negligence, or isolation. Next, please. So, and go ahead and scroll through all this, Rhonda. When we sit down with a family for the first time as a financial planner and fiduciary, one of the things we have to talk about is I have to have a good understanding of where you are, not just with your money, but also sort of your goals and your vision for yourself. And then we talk too about what do you envision for your adult child, or what does that look like? So, we ask nosy questions. What are your saving and spending habits? What are your short, mid, and long-term goals? What do you want for your own future? As well as what do you envision for your adult child's life? We're starting to have these conversations for my daughter right now. And I will tell you, my husband and I, in the beginning of this conversation, we're definitely not on the same page. And that is very normal too. So it is really, really important that we have tools and a good, healthy conversation. Sometimes it's good to have a therapist help you through this too, but that also represents your child's point of view. So one of the things that I brought to the table that my husband was really not in favor of in the beginning was, Dan, I think, Hudson deserves to have her own supported living environment. And my husband was very, very against this. He said, no, she's going to live with us forever. No one can protect her like I can. And there's too much risk in having her somewhere else. And I completely understand that. It's a fear of mine too. However, I do not see my daughter being happy living by herself with us and not having social community involvement on a regular basis. I don't think that's fair to her. And I will tell you right now, she she'd probably, with her communication device, yell at us every day. I mean, it just would not be fun for anybody. So one of the things we talk through is where does Hudson want to live? What does Hudson see for her future life? And I want her opinion on that. So we get their perspective. Every self-advocate I've met, it has very clear definitions of what they want usually in terms of their lifestyle and where they want to live. And so let's ask that. Let's document that. And then it's our job as parents to figure out, okay, how do we support that? How do we provide day-to-day care? How do we create checks and balances on their life and their support so that they are safe and they continue to be that way? And then what social activities do we want them to be part of so they can build their own community going forward? Next slide. Once we do that, then we start working on how to maximize benefits. And what are those benefits? So the main big federal level benefits are here on the screen. There's lots more in terms of county, local, and state resources as well. But the big ones here are Social Security, Medicaid, vocational rehab, public school services, and then the VA. Okay. Social Security by itself, just that top bullet, has 3 different programs. And people get confused all the time on Social Security. SSI is one program, SSDI is another program, and then Social Security Retirement is a third program. Yet everybody just calls it Social Security, which makes it super easy to, figure out who you need to talk to in the system. Medicaid is also confusing because you have traditional Medicaid and then Medicaid waivers, which are 2 separate systems. And actually in the state of Kansas, they're 2 completely different departments that are not even in the same building. So also getting involved, another plug to get involved with your DD council, because you start to learn how those systems are organized and who makes what decisions. But Medicaid is a really important one. How do we qualify for home and community-based supports? Some states have very long wait lists to get a waiver. Texas, their main waiver has a 17-year wait list right now. Kansas is 8 to 10 years. Lots of issues in terms of waivers, sometimes depending on the state you're in. And then other states do a really good job of funding their waiver programs, and there are no wait lists, and the benefits are on the ground for families very, very good. So sometimes when parents retire, we start talking about that. Is it important that you stay where you are if you are in a state that doesn't offer those same high-level supports for your child? And maybe that's a non-starter for you because your family lives in the state, and that's fine. We work with you wherever you are, but it is a consideration. Certainly voc rehab, public school services, we know about these benefits and programs. And if we have military service in the family, sometimes the VA can be very helpful. Okay, so knowing who to talk to, which programs to apply for and when, very, very important. Next slide. So one of the biggest programs that we are going to talk through, one more, is Social Security, because this is the one we get the most questions about. SSI, just as a basis, and many of you probably know this, I'm seeing lots of familiar names on the attendee list today. But when you have a child that turns 18, and under the age of 18, Social Security looks at the parent's income and assets and then the household size as a determinant for if your child qualifies for SSI. So for example, if you have a family of 4 making greater than roughly $47,000 gross income per year, your minor child will not qualify for SSI. However, once your child turns 18, then they are an adult in most states. And that means now the Social Security system looks at their income and assets, not the parents anymore. This is why we need to make sure the $2,000 limit and that is respected, right? We don't have that in their name. Otherwise, they won't qualify for this at that time. In addition, gross income will apply when it comes to SSI. So it's an income test as well. And roughly $900 gross income or less is the kind of maximum amount your child can earn. I have a lot of families who say, well, my child works more than that. They work full time at the grocery store. That's great. They don't need SSI then. That's fantastic. Let's plan around their earned income, not being dependent on SSI. Their Medicaid waiver is separate from that, which is a whole other list of benefits. In 2026, we saw a COLA increase on SSI to $994 a month for a single person. So that's also something to be acknowledge or have knowledge around is if you are applying for SSI for the first time this year, your maximum is 994. If your child doesn't receive that maximum, it's a good thing to ask why. Sometimes it's because of their employment income, but if it's not and they aren't working and they're still not getting the 994, then something happened in terms of that application process, and we probably need to appeal it. Okay, so these are different things that come up when we start to look at the financial planning for the adult with a disability. Next slide. When the parents retire, so when my husband and I get to retirement age, there's another triggering benefit that occurs, and this is called the Disabled Adult Child Benefit, or the DAC benefit. There's all kinds of acronyms, right, in all systems. It's just so fun. If your child was considered disabled before age 22, they will be eligible for this DAC benefit on one of the parents' work records, which is nice because that now takes SSI and replaces it, and it moves it into SSDI. And usually SSDI is typically, again, based on the parent's work history, around 50% of that is now going to go to your adult child for the rest of their life. And if that DAC benefit is approved and mom or dad pass away, 2 days after that happens, they still receive that benefit for the rest of their life. In addition, SSDI is not an income-based test, so they can work as much as they want and still receive SSDI. So that's wonderful, as long as that's a DAC benefit. Next slide, please. This slide is probably the heart of why I became a financial planner. I've worked with a lot of folks in my industry and training other financial planners across the country. And this is the one thing that I'm still frustrated that our industry does not do a better job of. And that is quantifying the cost of your child's long-term life, meaning we have to do their own long-term retirement plan in their supported living environment. We have to look at that because if we have an environment where government benefits are not always funded, and by the way, newsflash, they're not, and all of a sudden some of those benefits now are reduced or they are forced to change living environments because of reductions, we've got to have a backup financial plan for them to live on and continue to live in a supported environment. So we have to figure out what is it that your child needs. So what's their budget, right? What are government benefits providing? And certainly, what is it that you are doing as the ongoing caregiver? And then what does the replacement team need to be doing once you can't do that care anymore? So this conversation is all about figuring out the future cost of care for your adult child. And we certainly bring all the team members to the table for this discussion. It's the financial planner. It definitely is the government benefits specialist. But it's also sometimes the estate planning attorney, because we may need to update the trust team if that hasn't been updated in a long time. If your child outlives you, and this was the big thing, the care you provide is not going to be free to them anymore, most likely, not across the board. So having a backup financial plan and knowing exactly how much that special needs trust requires at any given point is really important. Next slide. So the third-party special needs trust is typically the legal document that the attorneys will draft to provide a place for you to leave money or assets that do not count against your child's access to benefits. That's in short what a special needs trust does. There are lots of different types of special needs trusts. Third party is not the only kind, but a third-party special needs trust is typically 80 to 90% of the time what families are creating. Next slide. When you create one of these, you need an attorney that is licensed in your state to draft the trust. I'm a big believer in a trust management team, TEAM, more than one person managing the money, okay? I like seeing a professional trustee. I like having trust protector language in the trust, which means a certain number of people on that team can hire and fire the trustee if they want to. I like having a CPA at the table. I like making sure that there's some level of case management, whether that's private or provided for by the waiver. It's a big job, and the money is the thing that will secure your child's future. So I think it's really important to have a checks and balances system on everybody who touches that money. I think life insurance certainly can be a way to fund these trusts, but it's not the only way. The earlier you do this planning, the more choices and options you have on how you fund the trust. And a trust can be created so that any remaining assets will pass to your own family members, a charity, or somebody else in the family if your child with a disability passes away. So a third party trust is the one thing that does protect those assets to remain in your family or be designated to whomever or whatever nonprofit you want. Next slide. The letter of intent is a handout I will send. I love this. I think this is a great way as a parent to organize your child's instruction manual. I wish Hudson and Dominic came with these when they came out of my body. That would have been amazing if they, someone had just sent me an instruction manual to follow. Unfortunately, we as parents have to walk that journey on our own and, live through those challenges of figuring out their medical care, their socialization, and in general, their quality of life. But when you have a replacement team or somebody who's coming in to take over the caregiving, this is a godsend for them to have. So I like creating a letter of intent electronically. It's going to include Hudson's schedule, her medication list, her social activities, if and when she's employed in the future, certainly that. But it's also going to, document things like what are the little tips and tricks that Dana and I use to keep her safe and to keep her out of the hospital. Those are really important as well. And sometimes those aren't in her medical file and they're not in her IEP or they're not in her IFSP, right? These are little things that only we know how to do. And I think it's super important to have those updated and documented. I actually like using this document very practically. I will email this to, our backup caregivers when we're out of town. I will email this to her new IEP team. We just had a big transition into high school with Hudson this year. And so this was really helpful to use. We'll send this to you guys if you would like it. Next.
Hey, excuse me for interrupting.
Yeah.
But I think we're kind of way over time.
Okay, yeah, go ahead. I was just going to able
No,
account.
that's okay. Just finish up, but we need to speed up so I can.
Yeah, it's all good. You were a little late, so I didn't know if you were here or not. Okay. ABLE accounts were created in 2014. All states offer these, less than a few. You can put up to $20,000 into an ABLE account for 2026. The age requirement for the disability is now age 46. That was changed this month from age 26. And as long as the account balance is $100,000 or less, it will not affect SSI, and nothing in these will affect Medicaid. Next. You can basically spend ABLE accounts on anything that will benefit the adult or the child with a disability. So education, housing, transportation, all kinds of things. Next. I encourage you to go to ablenrc.org. It's a fantastic website that gives a lot of information about ABLE accounts. Next. And then don't forget to plan for yourself. Dr. Heller, it's all yours.
Thank you. Hi, everyone. I may be coughing a little. I just got over a fever this morning, but I think I'm fever-free now. So anyway, I'm Tamar Heller, and I direct our University Center of Excellence in Developmental Disabilities. And I'm also a sister of a person with intellectual and developmental disabilities, which was the motivation for me co-founding the National Sibling Leadership Network. So I am going to build on the future planning. It was really wonderful to hear the presentation on financial planning, because that is such an important part of future planning. And if you were in the first session and you heard about our virtual futures now, which is really all about developing that letter of intent and working out the family dynamics so that you can do that kind of planning that you just heard about. Because there's different people with different opinions and there's a lot of problem solving that happens as you're doing it. So that's really the feature of our program. So go down to the next slide. So what I'm going to do is talk a little bit in the time I have about aging and disability and how it relates with future planning, because it's really important to know as you're developing these plans, kind of what are some issues of people aging with, I'm going to say IDD for short. We look at health and retirement and housing, end of life care. Next slide. Okay, so as people age, and there's a development of chronic health conditions, the changes in the family caregivers and supports, retiring from employment, and receiving end of life care. So these are some of the topics that are important to look at. So if we think about aging successfully, I like to think about living on your own terms, adding value to society, family, or friends, and maintaining health and function. Not necessarily to live without disability, because that's not necessarily if you already have disability, which a lot of the aging literature calls successful aging not having a disability. So what does growing old mean? So we really think it's important to look at what do people with IDD say about aging, and how do they see that? Here's an example. It means that you are settled and know what you are doing. I am more kinder. I get along better. I have friends I'm happy with and that I do things with. For the future, I wish that I keep going happy and that I don't feel old and that I'm not in a wheelchair. Next. Here's another one. I feel people 50 years and older have the same chances as younger people have and more, especially people with disabilities. Finally, I feel older people with disabilities shouldn't let their age or disability stop them from getting the job or their dreams or having fun. Next. So what do we do? What are some of the ways that we think about it? So as a precursor to our future is now, we developed this engaging with aging person-centered planning for later life. And we started to look at how people understand aging and the life stages. One of the ways is looking at life story. How do people see their lives? How do they talk about it? Sometimes you use a picture of different ages so they can talk about it. What about rights and choice making? Taking care of their health, looking at where they live. Because sometimes what the person with disability wants is not the same as what a sibling might want for that person. And sometimes two different siblings have different opinions. And sometimes the parents have different opinions than the siblings. So it can get complicated. What are the friendships and community supports? And what about work, volunteering, and free time? End of life planning, but all this in the context of review and goal setting. So this was actually done mostly in day programs that we did doing the retirement planning. Next one. So some of the key aspects are to increase the understanding of aging in context and understanding self-determination. And, you know, it's not only what the person with disability wants, but also what the family wants. So family-centered, person-centered. And increasing awareness of potential activities and actions and use of problem solving and action planning. Next. So some aspects around the health. Generally, people with IDD have poorer health and earlier age-related conditions. For example, dementia, especially in people with Down syndrome. Osteoporosis for people who've been often with epilepsy or were in wheelchairs. Oral health is often bad and not covered well, and not clinics that they don't have to go to. Diabetes tends to be high as well. And there's a higher rates of falls. Next. There's also poorer health behaviors. There tends to be more obesity, especially people who live at home, by the way. Sedentary behavior, unhealthy diets, and it's all related to health-related quality of life. Next. So access to healthcare is an issue. There's what's called diagnostic overshadowing. So for example, people get a diagnosis of cancer at a later stage. They have undetected vision and hearing impairments, or they may have difficulty communicating symptoms. I can think of a woman who had this huge pain in her stomach, and for months and months, and she was acting out behaviorally, and turned out she was very constipated. And once they took care of that, she was okay. That's just one example. lots of polypharmacy. My sister's on 13 medicines. Deaths amenable to healthcare intervention. That's a really common thing. And there's a lack of treatment, testing for COVID. And one of the key issues there was the prevention of support persons at hospitals. And I experienced that when I tried to visit my sister. I'm her health proxy, and they wouldn't let me in. I had to, I kept making a big deal that I'm Dr. Heller. So they thought I was a physician, so they finally let me in. So next. I wasn't lying, but I wasn't a physician. I'm actually a psychologist in background. Strategies to reduce disparities. And you need greater knowledge about impairment and treatments. There's a real lack of medical education and health professional education about aging and IDD. Looking at poverty and unhealthy environments, looking at health promotion, improved access, accessibility, equity, and effectiveness of healthcare, and you'll have better health and fitness. Next slide. So we've been working on several different projects. The big one is the Health Matters exercise, nutrition, and health education curriculum for people with DD. And that curriculum is done all over the country and in several countries, quite a few countries as well. And it is considered evidence-based by the administration and community living. So that one is now, you'll find out more about it. Living Well with Disabilities out at University of Montana. It's more general, but also includes people with IDD. And We Walk is a new one that we'll talk about next. So this is the Health Matters program. And it was really a cool one with we had a lot of funding to do this, and it was evidence-based and random design and all that. But we had 1 hour of health education class, 36 interactive classes, a personal notebook, etc. There's YouTubes. Next slide. Here's just an example as one of the guys that was in it. This is the stages of behavior change. We were working with an aging center, and we were using their kind of techniques, etc., and adapting it for this group. So it shows pre-contemplation, contemplation, making plans, action, maintenance, and then relapse and stopping. So we know this happens to all of us when we're doing exercise or nutrition. Next. So the aims are to increase understanding of aging and context, choice-making, self-determination, use of problem-solving, and awareness of potential activities and actions. So next. And then how do you sustain a health promotion program? So you really need to look at what's going on in the day programs or at home, or, how do you get it going? And for yourselves as well. How do you keep going your routines or your diets or whatever? So you need a supportive environment. That's the most important. Next. Just to show you some of the outcomes that we had, there was an improvement in exercise knowledge, more confidence, their ability, greater life satisfaction, better fitness, caregivers, more positive perception of exercise benefits. And then we did train the trainer. And so we were not doing the training because we don't really do it that much anymore. We train the trainer. And so less pain, greater self-efficacy for exercise, and more social environmental support. So in the train the trainer version. Next. This just shows our reach. We've worked with over 2,000 people with ID and 147 organizations, etc. So next slide. This is the We Walk program, and it's a technology intervention to improve the physical activity of adults with ID and the caregivers. So it really benefits both. And it's a technology intervention with Fitbits and tracking and lots of monitoring back and forth. Next. Another part is planning for living arrangement. So you talked more about caregivers in the last session that you did. But the thing is, you need to think about the changes in the family situation and what's going to happen and who's going to take over and how's that going to work. And I know when my parents, my sister lives about an hour from me in the Chicago area. in a group home. And when my parents moved to Florida, they were like, you're in charge now. But my dad still did a lot of the financial stuff for her. So, I had to think about those kinds of issues. So things change and you have to look at options in the community. I had an employee that had a son with Down syndrome, and she used to get angry when she was doing this training and say, but we don't have any good options in the community. So, and we have to think about what the roles are. For example, my sister's in a group home. She calls me 3 times a day, probably while I'm doing this. And she knows I only answer about once a day. She knows that. But she's the one person who wants to talk to me more than anybody else in the world. So, okay, I have to appreciate that, right? Okay, next slide. So if we think about employment, I just have to say this is my short version, but I've done whole day workshops on this stuff. So this is just giving you snapshots. These are some stats that we found. You might have better stats on Kansas, but from what we could see, only 17% people with ID in Kansas had a paid job in the community. But 36% in Kansas do not have a paid job and want a paid community job versus 44% nationally. And 26% of people with IDD in Kansas live with poverty compared to 10% without IDD. So these are just some examples about that. And that's true in many places. If we think about retirement options as people get older, you have volunteering, recreational and health promotion activities, senior center participation, and continuing ed. So lots of other things to consider as people get older. But we found that often people want to keep working because that's where they get their meaningfulness. Next. So transitioning to retirement, there's a very cool project out of Australia, but by Roger Stancliffe. And they worked with community groups for volunteers, with mentors. They had planning meetings. They trained, these are older people that were mentors. And they looked at choice of the activities and provide ongoing support. So people did different things. Some people did stuff with garden clubs. Others went to senior centers. Others wanted to do other kinds of activities. Next. So end of life issues. We have an under recognition of health issues, which we noted, and little training in palliative care. I heard a doctor once say in a conference that those people don't have a sense of pain. I think they don't know how to communicate pain sometimes. And greater barriers to hospice care, and understanding of death and losses, and really you need to train staff in this. So this is quite a story, is that my sister, who's 63 and has cerebral palsy and lots of physical things, has a cat with 9 lives. And as her health proxy, I've been called many times about do not resuscitate, etc. So the last one, she had great pain. Doctor called me, said it looks like she has cancer in her spine. We see 3 nodules. It's not worth doing a biopsy, etc. So I asked her, do you want palliative care or do you want hospice? I'm not dying. I want hospice care. I want palliative care. My dad, I already paid for a funeral and stuff, figuring, made arrangements, figuring it would be in a short time. She was on heavy doses of morphine. They put her in a nursing home for a while. She said, I don't want to be on morphine anymore. Take her off. She doesn't have withdrawal. And guess what? She didn't have cancer. She had a stress fracture in her spine. So what do you know? She was smarter than all of us. Next. So there was a curriculum we developed quite a few years ago on teaching concepts of death. Sometimes people don't really understand, and they don't get involved in funerals or some of the, they just say, oh, dad went away or something, and don't really explain what happened. And so they have to know that they don't return to life. Maybe they go to heaven or whatever their religion is about what they think happens to people, but they have to know that. And have to deal with the emotional responses. Next. I'm trying to stay in the time. And dealing with mourning and turning to others, and also the rituals. Next. So I want to end up by talking about the need for bridging aging and disability, because it's so important to contribute. There's so much great work being done in gerontology. And, that's why we're working with with US Aging and the area agencies on aging. I know Kansas is as well, or wants to do even more with them. We have common needs, and all these things I talked about, we have common needs. As people age, so many develop disabilities that need long-term care and need help, the same things. And they'll provide more efficiency in services. Next. That's the Chicago Bridge. I live right on the river, by the way. Next. So one example of bridging, the one before. Rhonda, can you go back? Oh yeah, National Task Group on ID and Dementia. That is a great site if you want any training around Down syndrome. They have so many different aspects. So I'm not going to go into detail, but I can tell you that they've been all over the world. They have training, they do train the trainers, they have support groups. So this is all around ID and dementia, not just Down syndrome. So next. Next is the Family Support Research and Training Center that I'm a co-director of, and which is because it's at our center, and it bridges aging and disability across the life course to advance family support and promotes evidence-based practice. What might be useful is, if you're interested, is they are doing family support stories. And so they do all, these are on these websites. So that's why I put this up. And I will send the PowerPoints so that if you're interested in seeing that and some of the projects that we have, and actually it's the future planning is part of what we're doing as part of this center now. Next. So this is my last slide. So looking to the future, what are some considerations in future planning? Thinking about some new things. How about the greater use of technology and universal design to address age-related changes? Maybe you need assistive technology, or you need some remote stuff, or remote technology, or transportation assistance would be another piece, especially if you're in rural areas, which many in Kansas are. And then the whole issue of the workforce and community capacity. We know that's a dire issue of not, if you have the person at home and trying to get help. And there's growing recognition of supportive decision-making, interdependence, and not everybody needs to have a guardian. If you have supportive decision-making, I don't know if you have that in Kansas officially, and the need for research on better ways to bridge aging and IDD. So, thank you.
Awesome. Thank you, Dr. Heller. I appreciate you going quickly through that. I know we were strapped on time a little bit, so thank you so much.
That's okay. It's okay. I saved my voice. I didn't cough.
Perfect. Perfect. Well, we're right at time. Can you stay on for maybe just questions for 3 minutes? If anyone,
I'm fine. I don't have anything right now. If people want to stay.
If there's any questions, please drop them in the chat. Kacy had to hop off, but I dropped her email if anyone wanted to ask her questions directly. If you have to go, please email me any questions you might have for Dr. Heller, and I can pass those on and get those answered for you. I will be sending out the recording and slides, so you can also ask me questions there. We appreciate you all attending for this important conversation. And thank you, Dr. Heller, for your time, and Rhonda for your time as well. We appreciate it. Okay.
And you may be hearing more from us. We're working with the area agencies on aging to do train the trainers around planning for the future.
Amazing.
And I think it's really useful, the information from Kacy as well. Because
yes,
I think combined, you need the letter of intent, you need to do the stuff we're talking about, and then also that prepares you to do wills and some of the other stuff you have to do, more legal, financial.
absolutely. All right, we just got some thank yous. Awesome. Appreciate you all being here. Have a great rest of your Friday.
Thank you.